There is so much that organisations in the UK can do to help close the gap in health inequalities for asylum seekers. I'm Kathy James, a nurse with 6 years of experience coordinating medical projects across 8 different locations on Europe's borders, as well as providing medical care here in the UK. With no legal way to claim asylum in the UK without first entering the country, and no safe routes available for many refugees, I have witnessed firsthand the harsh realities they endure. I've seen the scars of torture, the effect of border violence, and the devastating impact of walking long distances or spending days in unseaworthy boats. Seeking asylum is a human right. The Universal Declaration of Human Rights recognises the right to seek safety in another country, and 149 nations, including the UK, have committed to protecting refugees under the 1951 Refugee Convention. Asylum seekers make up less than 0.2% of the UK population. In this video, I speak with 3 asylum seekers living in Accrington, Lancashire. They share their personal experiences and highlight what we can do to improve health conditions for asylum seekers in our communities. This is their story.
Hello, my name is Marie Yousufzai. The reason I left my country was the bad situation of Afghanistan. We went to airport. We tried to go to inside the airport, but there was like too much rush, and there was lots of people. They were trying to leave the country. We stayed there for 3 days and 3 nights. UK government were sending emails to my dad, as soon as you can come to the inside the airport, you will save your life, and we will just take you to the UK. There wasn't that much money, like there was no bank to take out your money from the card. And during this time, because my mom, she has like liver problem, and she's ill, to don't eat anything or don't give her medicines. So when we arrived to Manchester, my mom, because she couldn't get any medication or like to see the doctor, she went to hospital. She stayed for about 3 months. We was happy and sad. We were happy because we saved our life, but when we saved our life, we have got lots of other problems. Just my dad could speak English at that time. So sometimes she got like interpreter, but not all the time. Most of the time she was in a big problem with the speaking language. When she was needing anything, like nurses, they were talking with him by hands. Now I have a big skill. She's saying I can speak with my hands as well. It was really hard for her. When we came to the UK and then the doctor start the treatment of my mom, it wasn't easy. They will say your appointment is next month. After 1 month, 2 months, 3 months, you have to be free for the appointment, because if you don't go to the appointment, you will just miss it, and you wouldn't be able to get it about like 6 months, 7, 8 months. People, they need to believe themselves first. If they can't believe themselves, it's not possible to live in a different country with different language, different culture. Sometimes it can be so easy, and sometimes it can be so hard. So just never ever give up.
When Marique's mum was waiting to leave Afghanistan, she had no access to medication or food. The stress of fleeing her country, combined with malnutrition and lack of medical care, had severe consequences for her health. Many asylum seekers face similar struggles, going months or even years without adequate food or health care on their journey to safety. I have seen patients' medication destroyed by border officials, their medical documents lost, leaving them with no record of past treatments. By the time they reach the UK, many have gone without essential medications for long periods of time, worsening their conditions. Once here, they face new barriers to healthcare. Without translators, unwell patients are forced to communicate using only hand gestures, making it nearly impossible to explain symptoms or understand medical advice. Critical information needed for medical treatment is lost when interpretation services are unavailable. And then there's the loneliness. Some asylum seekers spend months in hospital with no family able to visit, either because they're alone in the UK or simply cannot afford to travel. This isolation has a lot of devastating impacts on both mental and physical health. Befriending services run by community organisations can help ease these burdens. Marique also speaks about the difficulty of attending medical appointments. When seeking asylum in the UK, people must attend multiple legal and asylum interviews that determine their right to stay. These often take priority over medical appointments, and when asylum seekers try to reschedule, they are met with long waiting times, causing their conditions to deteriorate further. Organisations can play a vital role in helping asylum seekers navigate the NHS, from assisting with rebooking appointments to ensuring that they don't miss crucial medical care. Health services can also adapt, offering more flexibility to asylum seekers, reaching out when appointments are missed instead of removing them from waiting lists. Small changes can make a big difference in ensuring those seeking safety receive the healthcare they desperately need.
My name is Michael. I am from South Sudan. I left my homeland because I was forced to join the army. I expressed my opinion that I don't want to be part, but they were not happy with it. So they came and arrested me by force. They tortured me. My biggest challenge was crossing the channel. It is a tough decision to make. We entered the boat and we experienced a lot of wave. It was like a matter of life and death. The wave was too much. The boat was also full. It was too heavy to an extent that our belongings were thrown into the water just to reduce the weight. We spent about 16 hours in the water until the rescue team came and helped us out. The medical system is not free in South Sudan. It only favors those who have money. When you don't have money, you have no access to some medication. If you go to government hospitals, sometimes it is very hard even for you to get paracetamols, leave alone other kind of drug. In the UK, I told them that I was having a pain, because I was tortured, and I had the opportunity to talk to my GP. I explained everything, and he really felt what I went through. I even told someone that this person went through a lot. Until now, we are still working on it, and I'll see what is going to come out of here. As I came here, I came as someone who is seeking for refuge. I'm seeking for help, a chance of living without a fear of being persecuted, a chance of living without being tortured. You put yourself in someone's shoes. You have to know what the person went through, what the person needs, and all this. Then the world will be a better place for all of us.
Michael spoke about the torture he endured in South Sudan. Survivors of torture don't just suffer in the moment. The physical and psychological effects stay with them long after. While treating the physical injuries is crucial, so is referring survivors to mental health services. Many experience PTSD, which can have devastating consequences, impacting their daily lives and their future. When organisations encounter survivors of torture, referrals for torture reports through groups like Freedom from Torture can be vital. Trained professionals can document their experiences, providing critical evidence that may support their asylum claim. I have met many asylum seekers who have been tortured, not only in their home countries, but also at borders within the EU. This trauma often leads to deep fear of uniforms and officials. I experienced this firsthand as a district nurse when I visited the home of an asylum seeker. The patient refused to open the door, too fearful to let me in. Only after leaving a translated note explaining who I was, what I was there for, and when I would return, was I able to gain access. He had been conditioned to distrust anyone in a uniform, fearing for his life. This fear extends beyond victims of torture. Many asylum seekers avoid seeking medical care because they're worried they will be detained or deported if they are not officially registered. This prevents them from accessing essential healthcare services.
My name is Leroy Puitanda Karokohe and I live in Accrington. I'm from Namibia, country southwest in Africa. What I want to say is to the British government, they're doing a good thing. They must not stop helping us as asylum seekers. I'm grateful for how they treat us and how they're taking us into their country. But what I should improve is they should hurry up the process, because the process it's a constraint to us. Some people who are not strong enough, they get depressed and commit suicide. We have a high level of suicide on refugees in the country, and people are not talking about these things. But there's a depression virus or depression disease that is in my people. My African diasporan people, we are committing suicide every life sciences center. We need help with those things, like getting to those people and trying for them to get therapy and talk about their problems. There's a lot we can talk about and there's a lot we can do to help.
Leroy speaks about the devastating effects that long waits for asylum cases have on the mental health of asylum seekers. The repeated refusal, destitution and fear of deportation take a severe toll, leaving many asylum seekers in a constant state of anxiety and despair. In many cases, the psychological burden becomes unbearable. The true scale of this is difficult to measure. We have no reliable data on how frequent suicide attempts, and suicidal thoughts are in this population. But what we do know is that prolonged uncertainty, combined with trauma, creates the perfect conditions for a mental health crisis. During the pandemic, Home Office decision-making stalled, leading to severe backlogs. Shortages of asylum accommodation forced thousands of people into hotels for months or even years on end. These hotels, described by residents as being like a prison, became places of isolation, hopelessness, and deep psychological distress. The impact of this extended limbo has been profound, leaving asylum seekers trapped in uncertainty with no control over their futures. Research has highlighted the severe mental health struggles faced by refugees and asylum seekers. Key themes have been identified related to trauma and suicide risk amongst asylum seekers in the UK. The deep sense of loss of stability, connections, dignity, and belonging. Many struggle with not being believed, feeling forced to conceal emotions, and experiencing severe mental health symptoms such as suicidal thoughts, flashbacks, and overwhelming anxiety. A lack of social support and prolonged asylum-seeking processes were a major factor in their suffering. Those working with asylum seekers should receive specialised training in suicide prevention that acknowledges cultural differences in mental health. This training should build confidence in discussing suicidal thoughts whilst recognising the stigma that may exist in different cultures. Asylum support organisations, NGOs, healthcare services and Home Office representatives need to work together to provide a coordinated, targeted approach to asylum seeker mental health. The mental health crisis facing asylum seekers cannot be ignored. No one should have to suffer in silence. It's time for action, collaboration, and meaningful change. Health inequalities for asylum seekers in the UK are significant and arise from multiple barriers that prevent them from accessing healthcare with the general population. These inequalities stem from legal, financial, cultural and systematic factors leading to poorer health outcomes. How you as an organisation can help. Ensure all asylum seekers are able to register with a GP without unnecessary barriers. This means having translated leaflets helping asylum seekers to know their rights and how to access treatment. Provide better training for all staff on asylum seekers' healthcare rights. Improve access to interpreters for medical appointments. Provide accessible mental health services for asylum seekers who are specially trained. Provide gender specialist information in gender-safe areas such as information on female genital mutilation and gender-based violence and how to seek safety. Health inequalities for asylum seekers in the UK are preventable, but require policy changes, better awareness and improved support systems. Addressing these issues will not only improve asylum seekers' health, but also reduce long-term pressure on the NHS. You can find helpful resources here, including translated leaflets on accessing healthcare in the UK, and organisations that provide great services such as torture report writing, which can make significant differences in the claim for asylum.